Once you have your probe connected, you can select a preset, so you can come up the top here, and if you don't have a static preset already created, I would suggest starting with the musculoskeletal preset. Then what we're going to do is begin by placing the transducer on the lower face. So we'll start just in line with the mandible down here, and we're going to make some adjustments to the image to make it a little bit clearer, a little bit easier for us to see. So the first thing we're going to do is we're going to change the depth, and we do that just by swiping on the touch screen, so we make it a little bit less deep. And then the next thing I'm going to do is I'm going to increase the gain. I do that just by swiping up on the left hand side of the ultrasound image. So now I can see at the very bottom of the screen, we can see either the mandible, the white bone if we're down towards the bottom here, or if I bring it up a little bit higher, I can actually see the curvy white teeth. And above that, I'm going to get a cross section of the DAO, which is this muscle, this dark semicircular muscle in the middle of the image at the moment. So I can probably make that a little bit bigger just by adjusting the depth again. The other thing I'm going to do is adjust the frequency, and we can just use the slider on the left hand side of the image there. Adjusting the frequency, increasing it, gives you better resolution. Sometimes it gives you worse penetration, but for the face, that's typically not an issue. So here we are on the lower part of the face, in line with the mandible. If we come posteriorly back up towards the ear, we can see the masseter muscle. So masseter muscle is the mandible, this white bone at the bottom. Anything that's reflective of sound waves is going to appear bright. We have the muscle above it, and then we have the SMAS layer above that, so that's that thick white connective tissue, and then we've got the subcutaneous fat. So can you do a few jaw clenches so we can see that masseter muscle bulging? We can see it bulging there. Perfect, and relax. And if we come right up towards the ear, we can usually find the parotid gland, which usually has a fairly homogeneous speckly appearance, and we can look for a lymph node within that parotid gland as well. It's usually a dark kidney bean shaped structure. Let's have a look around and see if we can find that within that parotid tissue. I can't see that very clearly. So let's move on. Let's go down to the DAO again. So we've got the DAO down here. Now underneath the DAO, we also have the DLI. So could you make a bit of a sad face? So you can see, you can see a little bit of that DAO moving a little bit. And then we're going to put the colour flow on and bring the colour flow box up. So you can just adjust the size of the colour flow box by using your fingers on the screen. So anything that's causing movement is going to show up in the colour box. So the red and blue means either flow towards or flow away from the probe. Red is usually towards the probe, and blue is usually away from the probe. So right now we're just over the facial artery, and you can see the same vessel has blue and red because some parts of it are moving towards the probe and some parts are moving away from the probe. For the face, ideally, you want to put your colour frequency, which again you can just adjust here, up to 6.3. That's going to see how that just made it a little bit more strong, the signal. So it's 6.3, and you can adjust the PRF, which is, it means pulse repetition frequency, but basically what it's looking for is changing the speed of flow that it's detecting. So if I decrease my PRF, it's going to be more sensitive to lower flow, and I decrease my PRF by swiping up on the screen. So for the face, you usually want around about, let's have a look, 1 kilohertz is usually pretty good. There we are. So that's lower face. We've seen masseter, we've seen the parotid gland, we've seen the DAO, DLI. We can also have a look at the chin. So if we bring the probe into, I'm going to take colour flow off just to make it easier to see the 2D structures. A little bit of extra gel. If we put the probe in the midline, and you can actually put a centre line on your image. So if you put this up here, these 4 little squares down there, bring it down to the lower part of the menu and choose centre line. That'll give you a marker that corresponds with the marker on your probe. So with the centre line marker on, we'll be able to put the probe right in the middle of the chin, and we'll be able to see on the ultrasound where the centre of the chin is. So you can see the bone usually have this little white fibrous fatty tissue, which is this little circle just above the bone here, and then you can put the colour flow on and have a look and see where the vessels are in relation to the center line. So if I put the probe on here and I'm looking for colour flow, usually I have to go underneath the chin. Can you just lift your chin up just a second there? I'll see if we can see any of that colour. Let's bring the box right to the top of the screen. And sometimes you really have to tilt and rock the transducer like I'm doing now to put it at a bit more of an angle. I can only just see a little bit of that vessel on that side there. I'm going to increase the colour gain. And just every now and then I was picking up that vessel just off to the side. There it is again. So I'll hold still there. And we can see just off the centre line, just by a fraction, we have that ascending mental artery. So I'll position that in the middle, and that's just probably a few mil to the left of centre. So that's the chin. Moving up, we're going to do the temple area. So a little bit more gel on, take the colour off, put the probe back on the temple, and we can see beautiful temporal bone there. Temporalis muscle straight above the temporal bone. Can I get you to clench your jaw or open the jaw a few times? Nice. And then you can see the deep temporal fascia, the fat above it, and we can see the superficial temporal fascia as well, the white lines at the top of the screen there. And then if you want to have a look at where the arteries are in relation to the bone, we can put the colour flow on. And usually we check down here. I'm just going to decrease the gain of the colour because it's a bit too much. And let's have a look and see if we can find those deep temporal arteries. There it is. So that's that anterior branch of the deep temporal artery that we're seeing just above the temporal bone there. Let's have a look and see if we can see that superficial temporal artery as well. So the superficial temporal artery will always sit above the superficial temporal fascia. Sometimes you need a little bit of a gel standoff. It's very handy on the linear handheld probes if you can have a nice little gel standoff like that. Make sure you hold the probe down the end here, so you can even have it so that the probe isn't even contacting the skin. It's just sitting above, and that gives you a nice standoff to be able to see. I'm going to turn that gain down a bit more. See some of these more superficial structures. There we are. And you often need to do a bit of tilting and rocking to find those superficial vessels, which you can see there. I'll just put that into the middle of the screen. That's probably just around this area here in relation to the marker. Now if we just go straight into the mid-face, if you just bring your head over that way. So my position for the temple is here, and we're going to take some gel and we're just going to go down into the middle of the face, and we're going to find the piriform space, which is this area down here in the middle of the screen. We'll bring the probe to the nose and we'll see if we can find where that angular artery is, which should sit in this area somewhere. And if we're not seeing it, you can just tilt the probe, move the probe back and forth, and you should find somewhere in this area, there it is, that angular artery. So sitting well above the bone. And just lateral there. I'll just turn up that colour gain again just to see if I can see that a bit more clearly. Yeah, that's better. So I can see that sitting quite superficial there. Again, I'll just turn down the colour gain so there's not too much noise. The other thing you can do if you're getting a lot of noise like I am at the moment is you can actually go into the settings of the colour settings in here, and you can turn on flash reduction. So there's an option here that says flash reduction. You can find it there, and I'm just going to turn that up to the max, and that should help us to get rid of some of that noise that we're getting. Yeah, that's much better. You can see the angular artery, top middle of the